Reporting for Heart Rhythm TV from HRX 2022 in San Diego, I'm Mehek Dande, and I'm joined by Dr. Fatima Rodriguez. Thank you for being here.
Thank you so much for chatting with me.
Of course. She is an assistant professor at University of Stanford and a cardiologist. We just came off of a fantastic health equity session, so I would love to pick your brain about some of the important topics that were discussed. First of all, trust. It's very important to build trust with our patients if we want them to utilize some of these healthcare technologies that are meant for their benefit. But how exactly can physicians build that trust from the get-go?
Thank you. That's a really important question as we think not only about health tech interventions, but also around using patient-generated health data for research and clinical purposes. I think it's very important to be open and transparent with our patients and tell them exactly what we're going to be using their data for, that we're using it to help them as a tool, and very important that we've heard a lot this conference is that they own their data and they can control the data, access the data, and we can help them understand that data.
That's a really good point. The idea of owning somebody's data in perpetuity might be intimidating for patients and they may not understand what we're using it for, but I think that transparent open communication is really, really essential. Now, I know you've been involved with some excellent work in the space of health equity. Tell us more about your work and where is there more room for folks who are interested in digital health and want to make an impact in terms of health inequalities, where could they go?
Great question. I should start with a disclosure that I am not an electrophysiologist. I am a preventive cardiologist, so I use technology a lot to help with patient behaviors, team management, digital interventions. My other hat is that I'm a clinical researcher, so digital transformation of healthcare is here to stay, and I use these tools for my clinical research trials, decentralizing trials, getting patients more engaged. And in my research, because really a lot of the data that we use in research is not data that's easy to understand without the use of AI or other technologies to kind of mine EHR data, patient-generated data outside of the healthcare system. So a lot of exciting projects in that space. And I'll say, as a clinician, as a doctor, I use a lot of that every week in my telehealth encounters with my patients and with our healthcare team. And I'm probably one of the few people that likes Zoom, and I like Zoom meetings because they allow more access and connectivity with other healthcare professionals and our patients.
Of course, a lot of work to be done. And as you said, telehealth, if combined with appropriate streamlined data flow, especially sensor-driven data or long-term trajectory of patient measurements of blood pressure, weight, what have you. We were talking earlier about your excellent work in AFib, risk factor modification and interest in that area. So I think once all the stakeholders are at the same place, such as a meeting like this, I guess we could really hit that nail on the head. So dovetailing on that, what do you think is the role of a conference like HRX in achieving that pious goal of keeping the patients at the center, achieving health equity, and really making an impact?
I think this is a great conference. It's my first time in any HRS conference type settings because it brings so many different stakeholders to the table. We discuss this. I'm a preventive cardiologist, but I'm also trying to prevent atrial fibrillation, prevent exacerbations of atrial fibrillation, improve medication adherence. So we're all doing this for the patient, it's at the center. But there's different stakeholders that need to be involved. And I think this conference is unique because we have those diverse perspectives. In every panel, we have industry perspective, we have the clinician perspective, and really important, we also have the patient perspective. So we need more meetings like this. But what I would like to see, and this is kind of a call to action, is that we have a follow-up on all the great ideas that we discuss. What are the deliverables from this? What kind of new connections has this conference generated? And I think we'll see a lot of great things.
Yeah, that's an excellent, excellent point. I think moving forward as we envision HRX 2023, it would be fantastic to see what came of the ideas that were born at this conference. I think that's an excellent point, and we will definitely take that into consideration. Well, viewers, this was a fantastic conversation with Dr. Rodriguez. Thank you for being here, and stay tuned for more content.